Welcome. Today we're delving into lens particle glaucoma, a specific type of secondary glaucoma. Glaucoma, in general, is a condition that damages the optic nerve, often due to increased pressure inside the eye. Lens particle glaucoma is a less common variant, but understanding it is crucial for timely diagnosis and management. So, what causes lens particle glaucoma? It arises when lens material, specifically lens proteins, escapes from the lens capsule and enters the anterior chamber of the eye. This usually happens after trauma to the eye, cataract surgery, or even spontaneously, especially in mature or hypermature cataracts. The lens material can be in the form of small particles or larger fragments, all contributing to the problem. Let's break down the pathophysiology. When lens particles are released, they trigger an inflammatory response in the eye. These particles and the inflammatory cells themselves then clog the trabecular meshwork, the eye's natural drainage system. This blockage increases the intraocular pressure, or IOP, leading to glaucomatous optic nerve damage. The specific mechanisms involve both mechanical obstruction by the particles and inflammatory mediators reducing the permeability of the trabecular meshwork. Lens particle glaucoma is relatively rare compared to primary open-angle glaucoma. Its exact prevalence is hard to determine, but it's most often seen in individuals who have had previous ocular trauma, cataract surgery complications, or those with advanced cataracts. It's important to note that while anyone can develop this condition under the right circumstances, those with pre-existing eye conditions or a history of eye injury are at higher risk. The symptoms of lens particle glaucoma can vary, but often include eye pain, redness, blurred vision, and halos around lights. In some cases, patients may experience a sudden decrease in vision. Because elevated IOP is a key feature, symptoms can mimic other forms of glaucoma, emphasizing the need for a thorough eye examination. Diagnosing lens particle glaucoma requires a comprehensive eye exam. Key components include measuring intraocular pressure, gonioscopy to examine the drainage angle, and slit lamp biomicroscopy to visualize lens particles in the anterior chamber. The presence of lens material, along with elevated IOP and signs of glaucomatous optic nerve damage, are crucial for confirming the diagnosis. Visual field testing and optical coherence tomography (OCT) can help assess the extent of optic nerve damage. Unlike some types of glaucoma, lens particle glaucoma isn't typically categorized into subtypes. Its primary defining feature is the presence of lens particles, causing the elevated IOP and subsequent damage. The treatment of lens particle glaucoma focuses on lowering intraocular pressure and removing the lens particles. Initially, topical medications like IOP-lowering eye drops are often prescribed. However, definitive treatment usually involves surgical removal of the remaining lens material. This can be achieved through phacoemulsification or other surgical techniques. Anti-inflammatory medications, such as corticosteroids, may also be used to control inflammation. In some cases, glaucoma surgery, such as a trabeculectomy or tube shunt implantation, may be necessary if IOP remains uncontrolled despite other interventions. Prevention of lens particle glaucoma largely revolves around careful management of cataract surgery and prompt treatment of ocular trauma. During cataract surgery, techniques to minimize lens capsule rupture are crucial. After trauma, close monitoring for signs of inflammation and lens particle release is essential. Regular eye exams, especially for individuals at risk, can help detect the condition early. The prognosis for lens particle glaucoma depends on the duration of the condition, the degree of optic nerve damage at the time of diagnosis, and the effectiveness of treatment in lowering IOP and removing lens particles. Early diagnosis and treatment can significantly improve the outcome. Recent research has focused on refining surgical techniques to minimize lens capsule complications during cataract surgery and on developing more effective anti-inflammatory therapies to reduce the inflammatory response triggered by lens particles. Furthermore, advancements in imaging technologies allow for earlier and more precise detection of lens material in the anterior chamber, facilitating timely intervention.